Good morning, students. Today I am going to talk to you about septic arthritis. Septic arthritis. Septic arthritis is also called infectious arthritis. It is an infection of a joint resulting in inflammation and then subsequent effects. Before we say that, let us see the septic arthritis is an infection of the joint, the synovial membrane, and this generally involves the larger joints like knee joint, number one, the hip joint, the elbow joint, then the smaller joints, any joint, in the vertebral joints can also be involved. So these joints are of different nature, but we are going to focus particularly on the most common joint involved by septic arthritis, which is the knee. You have various kinds of joints which have, where the bones meet each other and they are linked with various structures which imparts movements. The muscles are attached to the, bones and they are inserted on the bones. At joints, the tendons, they help in movement of the joints. There are certain joints which are immobile, like the suture joints of the skull bones to protect the brain. There are various kinds of joints, as you know, the hinge joints, the ball and socket joints, the pectoral joints, the fibrous joints, so many joints. Like there are certain joints like inferior tibiofibular joint, which is joined by a ligament, which is immobile. So let's come back to septic arthritis. Septic arthritis is caused by organisms, mainly the bacteria. And the most common bacteria which is involved in the infection of the joint is Staphylococcus aureus, gram-positive Staphylococcus aureus, then coagulase negative staphylococci, they can also be involved, particularly in those people who have got prosthesis like artificial joints. Then it can also be caused by, viruses, fungi, and even parasites. And when the joints are involved, they give a typical presentation to the patient. And septic arthritis, mind you, is an emergency. It is an emergency joint involvement. Whenever there is infection, you see, we must know basically the structure of the joint. Say the knee joint, I'll give you explanation about it. Knee joint is a very mobile joint. It is a large joint, and it is a joint between femur and the tibia and patella and the femoral. So this is tibiofemoral involvement and this is patellofemoral involvement. The joint is covered by a tough fibrous structure which is called the capsule, and there are bursa also, the fluid filled bursa, which gives, it acts like something like a shock absorber. The capsule covering the joint has got, there is the inner lining of a membrane which is called synovial membrane. What is it called? It is called synovial membrane, which has got two layers. The synovial membrane has an outer layer which is highly vascular, which has got lymphatic vessels, which have got the nerves also. The inner layer of the synovium is the synovial cells, or the synovial cells. The synovium secretes a colorless fluid which is viscous. Okay, it has got a few cells and it contains hyaluron. The synovial fluid lubricates the synovial membrane, and it also provides nourishment to the cartilage. You see that the ends of the bones are covered by a cartilage which is quite smooth and avascular also. cartilage avascular. And in a knee joint in particular, we have the ligaments on outside, then they are meniscus, the medial and lateral meniscus. Okay, so which also these menisci also act as shock absorbers. So therefore, what I wanted to tell you is that if this synovial cavity, which contains the synovial fluid, is infected by organisms, it gets inflamed, it may become bulky, and there is an exudate inside. The moment this happens, the color of the synovial fluid changes from, it may alter its color. It becomes less viscous also. So say there is a bacterial infection. So where from the bacteria and organisms come, which involve this joint. So there are 2 or 3 routes. Number 1 is the hematogenous route. Say a person has got infection somewhere, say respiratory tract infection, say the infection of the skin, or infection somewhere else. So this infection, the organisms through the blood vessels involve the synovial cavity. When the synovial cavity is involved, there is, you find typical features of inflammation. What are those features? The patient will start having pain. The joint movement will be restricted because of the pain. The patient doesn't want to move his knee. If it is knees involved, there may be swelling of the joint. There is a pain, there is a tenderness, and if it is in advanced stage, there may be redness also. The person has got pain, fever, tenderness, redness, swelling, restriction of the movements of the joints. So immediately your mind should focus that when these features occur, the person may be having septic arthritis, and it is an emergency, right? We'll discuss the pathology later on also. The second route for a person to get septic arthritis is that person has already got diseased knee or diseased joint because of rheumatoid arthritis. The cartilage is destroyed or deformed, or person had, is immune compromised because of viral infections. Person may be a diabetic. A person might have a poor nutritional status. Person, might have undergone some kind of a procedure on the knee, say like knee aspiration or surgery to implant a prosthesis inside. And those people who are intravenous drug abusers, alcoholics, person who has suffered from some other disease, persons who are or had chemotherapy sometime back. So these are the people who are liable to get septic arthritis. Then other possibility is that you must go into details and ask the patient about the history. A person who might have been traumatized, person has got hemarthrosis, it is a collection of blood in the joint cavity, or there is some kind of an open injury. So these are the people. Besides hematogenous route, there are the possibilities of other modes of getting septic arthritis. I have told you, like trauma, previous disease, immune compromised patient, and things like that. The other bacteria, which I mentioned you about Staphylococcus aureus, but I would like to say is that the other organisms which are involved in septic arthritis, causation of septic arthritis, are streptococci of all kinds, gram-negative bacilli, Haemophilus infringui, various type of viruses, HIV virus, HTLV1 virus, Coxsackie virus, rubella virus, and among fungal infections, all kind of fungi, blastomycosis, coccidomycosis, all these may be involved. And there's a disease because of a tick, Lyme's disease. These are the people who are liable to get pain and swelling of the joints and septic arthritis. persons who have diseases like sickle cell anemia. Sickle cell anemia. These are the persons who may get septic arthritis. Coming back to pathology, let's continue further ahead. Once the joint is inflamed, it is infected. The joint cavity gets swollen because of exudate, inflammation. There is a bacterial proliferation. And subsequently, after, if you do not pay attention, do not pay heed to it, the infection involves not on the synovial membrane, it will go to the bones also, it will go to the cartilage also. And the infection may come into the joint cavity if there is a involvement of the epiphysis, because there may be, that is through the arterial capillaries. From the epiphysis, there is a link with joint cavity. And once the synovium is involved, the infection is called at that time, because this erosion is called involvement of synovium. It involves the bones also, and a condition termed as pannus develops. Pannus, P-A-N-N-U-S, pannus. And ultimately cartilage is destroyed and a person may end up with permanent disability. So therefore, one must pay immediate attention to a person who comes to you with history of pain, swelling, redness, fever, loss of appetite and restriction of movement of the joint. Think of septic arthritis and go ahead and start investigating these cases. And the best way is take a good, perfect history, duration of the symptoms, how the symptomatology and signs started off, what is the past history, what is his social and personal history, what is his nutritional status, what are his habits, what is his occupation, is he an alcoholic, is he a smoker, or one of the other causes which is quite common in Western countries, which used to be, they used to divide septic arthritis into gonococcal arthritis and non-gonococcal arthritis. You must take history of contact, because gonococcus is one of the causes. Neisseria gonorrhoeae, the organism Neisseria gonorrhoeae is implicated in causation of septic arthritis. So the patient will have not only the local features, he gives you different history of contact or thing like that, history of urinary tract infection, and you can do the culture of the swab from where a person is first infected by gonorrhea. All those things, the parts of the body where a person makes a contact, you can take swab and exclude gonorrhea. So let's proceed with investigation. The full blood count will tell you, the state of nutritional status as far as HB is concerned, anemia. TLC count will be raised. Person will have all the features of infection. What are the features? Clinical, you have already seen, and SIRS, systemic inflammatory response syndrome, SIRS, systemic inflammatory response syndrome. The pulse is increased, there is a tachycardia, TLC count is raised, or it may be less than 4,000 even. So TLC count is raised, the pulse rate is raised, person has got a temperature, his breathing is more than 19 per minute. Okay, so these features are there. Person having tachycardia, person having fever, person having increased TLC count, having respiratory rate more than 19, TLC count more than 11,000 per cubic mm or less than 4,000 per cubic mm, temperature more than normal, say about 39, 40, or it may be lesser also. So these are the features. And the other investigation we have to do is, you must say the nutrition status. Your liver function test you can do. See, the ESR will be raised. Erythrocyte sedimentation rate will be raised. ESR. So I'll explain to younger students that CBC, HB, TLC, DLC, ESR. ESR will be raised. C-reactive protein will be raised in infections. There is some infection somewhere, not very, very specific, but still. And what are the other investigations which are relevant? One of the most relevant investigation for a person who has got septic arthritis is to find out the source of infection. All right, whether the throat or some skin infection or things like that, or history of trauma is there. Then comes the X-ray. The X-ray will tell you involvement of the joint space, okay, and the structural abnormalities, soft tissue swelling also. Then comes you can also do ultrasound to see the amount of fluid inside, the localization of fluid, involvement of soft tissue. You can do MRI, is a very good investigation for septic arthritis. Okay. Then of course, you can find out the causative organism, which is by needle aspiration. There is a joint swelling, or there is a joint swelling. I'm talking about knee joint. There's a fluid inside. There's a pus inside. Large amount of fluid is there. Possibly there may be patellar tap. You can tap the patella and find, you can get a click sound. Lift it up. Fluctuation may be there from side. You press with the fingers, you can see. You press on one side and you can see the wave of fluid striking the opposite finger. You can see in your knee that there is fluid. There is some kind of fluid trail is there. All right. Patellar tap is positive. Movements are restricted. And at an appropriate place, from the sides, you put a needle inside and aspirate. Aspiration will tell you about the color of the fluid. It is greenish, it is white, and then you send this fluid for culture and sensitivity so that you can start an appropriate antibiotic. You can see for the cytology what are the cells. So you can send it for cytology, you can send it for biochemistry, you can send it for culture. So needle aspiration is one of the most important part of the investigation as far as septic arthritis with collection inside is concerned. Then you can also do arthroscopy. Arthroscopy means you visualize, you see the inside of the joint with an arthroscope. It will not only tell you about the type of fluid inside, but it will also tell you the involvement of the cartilage, the extent of involvement, to some extent the synovium. And with the same sitting, an arthroscopic sitting, you can drain out pus or fluid inside. And you give a irrigation also. Irrigation means you put a saline inside from one way, and through the this arthroscopic procedure, you can drain the fluid also. So it is used both for diagnostic and therapeutic. Diagnostic means you can find out what is there inside, and therapeutic means that whatever fluid is there, it can be removed. Okay. So thereafter, let us see what all we can. I will not proceed much, because then slowly and gradually I am giving you just a outline. So you have to read. We can be your facilitators. That means we can throw some light, we can make a sketch, we can make some idea, we can express few words, sentences, but thereafter I think you should read. And I am telling you, once you read it, after listening, you will be able to know much more than what a teacher is talking about. A student who reads First he listens. His mind is receptive. His mind is not going left and right. So he receives an input given by teacher, and it's a kind of a foundation. Therefore, go back and read. And then when we take a test, I've seen your answer sheets. Some of you have written so well, far, far better than what we talk about in the class. Okay. So let us see septic arthritis. I've told you. Now, how to manage. Management means investigations and the treatment. First and the foremost thing, before the culture report comes, person has got infection inside. That doesn't mean that you deny the patient the benefit of being exhibited antibiotics which can check. Once you have taken, aspiration, you have done the aspiration. Sometimes the joint swelling is there, you don't have arthroscope, so therefore you have to do repeated aspirations. I'll touch that aspect also. Twice a day you have to aspirate pus from the joint cavity, and this is the ideal treatment. Keep on doing it, and once you've aspirated and you are sporting it with the antibiotics, the joint swelling will come down and infection will be controlled. The other surgical management I have told you, one is, you open the joint, then open. You don't have arthroscope. You're doing needle aspiration, but the results are not satisfactory. So therefore, you can open the joint cavity, give an incision. Now, one should not put a drain in the joint cavity for fear of transmitting infection from outside to inside. So therefore, once you open the joint, you have done the arthrotomy, drain the pus, the fluid. And at times, quite possible, what is the necrotic material inside that has to be removed. Arthroscopy, the inflamed necrotic synovium can be removed. So therefore, this can be done. All right. But whatever procedure you do, let me tell you that if you are doing knee aspiration, make the skin sterile. Use conventional bactericidal, fungicidal, virucidal agents. All right. So needle aspiration, number one. Secondly, arthroscopic removal of the fluid and the necrotic material, or you can open the joint and necrosed tissue should be removed along with the pus and everything. Now, coming back to that, when a person starts having these kind of symptoms, please start the person, treat him first. Person individual has to be managed in a systematic manner and as a whole, patient as a whole. You've already found out, person has to be subjected. What I told you, his diabetic status has to be assessed. His nutritional status has to be assessed. Control that simultaneously. Control diabetes simultaneously, or any other infection somewhere. Give him antibiotics which covers all kind of organisms, gram positive and gram negative. Like, there's so many antibiotics like amoxicillin is there, flucloxacin is there, ceftriaxone is there, cefoperazone is there, ceftriaxone with sulbactam, 1.5 gram twice a day by intravenous route. You can get amoxicillin, clavulanic acid, 1.2 gram IV 6 hourly after test dose. You may give, aminoglycosides like gentamicin or amikacin along with the ceftriaxone. All right. Then they have got a wider spectrum, imipenem and meropenem and things like that, the whole. So 2 weeks you should give intravenous injections of antibiotics for a person with septic arthritis, and subsequently we can change over to oral antibiotics. So there's so many varieties. Fluoroquinolones are there, the antibiotics which covers both gram positive and gram negative organisms. So this has to be continued for 4 weeks. And what antibiotics you give? Wait for the culture and sensitivity report and give that antibiotic. All right. And then frequent reviews. Now, in certain situations, a person who has got prosthesis, even those organisms like coagulate negative, gram positive staphylococci, so they also start colonizing the prosthesis. It may be covered with a biofilm, may not be covered with a biofilm. So therefore, you have to take into account those organisms also. So besides giving antibiotics, what else we do? So microorganisms we are controlling, what else we do? Person must be given along with it. You see, antibiotics will control organisms, but because of inflammation, the person is having pain. So you should give to the patient non-steroid anti-inflammatory drugs. There is a WHO protocol about it for the relief of pain. You start with antibiotic painkillers, analgesics. Firstly, we start off with non-steroid anti-inflammatory drugs to main. Diclofenac sodium you can do, ibuprofen you can. All right, and there are so many analgesics in the market. Whenever you are giving analgesics, please ensure that these always, might have, not always, sometimes may have gastric erosions and affect the stomach. So if you are given oral non-steroid anti-inflammatory drugs, ensure that it is not given on empty stomach. No painkiller ever to any person should be given on empty stomach. It may cause erosion and even hematmesis and gastritis. All right. So therefore, cover it up with giving PPI, proton pump inhibitors. Proton pump inhibitors like pantoprazole, and old times we used to give ranitidine and things like that. So many drugs are available. You can give pantoprazole 40 milligram in the morning, which will protect the gastric mucosa from the effects of non-steroid anti-inflammatory drugs. So to make the patient comfortable, and patients, the mobility, patient with rest, he should be comforted. There is a very beautiful dressing which used to be called RJ dressing, Robert Jones dressing. Give a sterile pad of cotton cover to the, say, knee joint, and apply a crab bandage all around firmly but not very tightly. Have another layer of cotton, then apply second layer of crab bandage, the elastic type of a bandage, crab bandage. So it is padded, patient gets comfort. And subsequently, person who has been restricting his movements because of pain, he wants to remain, keep his knee joint at rest so that he doesn't get pain. So movement should be encouraged. Okay. And then regular follow-up is that. That's all I wanted to talk to you. And next time I'm going to talk to you about tuberculous arthritis. But so I'll just remind you, the septic arthritis is a dreadful disease. It's an emergency. It's caused by gram-positive negative organisms. May be caused by fungi, might be caused by gonococci, might be caused by viral infections. Immune-compromised patient like diabetic, intravenous drug abusers, alcoholics, person suffering from other diseases, and a person who has got chemotherapy and things like that, they are the candidates for septic arthritis, besides those who are having disease of the joint previously like rheumatoid arthritis, or persons who have got prosthesis inside, or persons who have been traumatized. And clinical features are pain, swelling, redness, restriction of movements, fever, etc. Investigation basically is, you do the basic elementary and basic investigations. But however, it's the X-rays and the needle aspiration of the joint cavity and the fluid and the culture sensitivity. You can ask for MRI also, and the treatment is by giving antibiotics, appropriate antibiotic, and needle aspiration. You can have arthroscopy and remove the pus and necrotic tissue, and a surgical procedure like open arthrotomy and drainage of pus and necrotic tissue, and even the dead type of infected bone. Immobilize, non-steroidal anti-inflammatory drugs, and then antibiotics. Thank you very much. Good day.